now return to Mark Willis and Road Dog Trucking News on SiriusXM's Road Dog Trucking Radio.
Drivers, I look forward to this every week. Dr. Fahmi Farah is on with us, and she is one of North America's leading cardiologists. She's board-certified invasive cardiologist based in the Fort Worth, Texas area. And, Doctor, it is always great to have you on the radio. I want to welcome you back. How are you?
I'm doing great. It's always great to be on your show. Thank you for having me.
Absolutely. Thank you very much for joining us. And, you know, what's interesting to me, just in, you know, daily observations of people I work with, that there's a number of people that I know in the business, media business, that are sick. Either they've got the flu or they've got a cold or, you know, good Lord, COVID. And they insist on going to work. You know, and it's an interesting phenomenon to me because, I mean, if you're sick, right? The company, whatever it may be, should allow you the time off to try to heal, to get better. But for whatever reason, people decide to push on, that they got to go in, they got to work, they may be fearful of losing their job, can't afford it, kind of a thing there. But if you're under that kind of pressure on two different fronts here, if a job is creating that kind of pressure for you to perform, even under being under the weather, that's not good for your heart, is it?
It's not, and I totally agree with you. When somebody's sick with viral illnesses, especially something as contagious as COVID, all employers really should allow their employees to stay home and get well, so that it's not only for their own health, but also the public, so that it doesn't spread. So I agree. I think as employers, we should all allow our employees to have adequate time to get well, recover before they come back to workforce.
Okay, and in a situation like that, somebody's going through what we mentioned, A, B, or C. What is that doing to the heart rate? If you've got a flu, if you got a cold, or, you know, God forbid, a COVID thing going on, what does that do to the heart? Added stress, pressure on the heart?
Certainly, it can cause added stress. You know, anytime we're fighting an infection, it causes an added stress to the heart, particularly viral illnesses, and especially COVID. There has been a definite link with COVID and heart disease, and particularly those who already have pre-existing heart condition and those who have risk factors like diabetes, high blood pressure. It really can impact their heart health.
Okay, absolutely. And this is why folks have got to get in and talk with their doctor about what is going on out there. In an event like that, cold, flu, COVID, are we looking at somebody running into maybe sleepless nights, sleeping disorders, sleep apnea? Talk about that. You got a blog up on your website at bentleyheart.com/blog about sleep apnea and just how dangerous that is.
Sleep apnea is a major risk factor for heart disease, and it is now recognized as one of the major risk factors by the American Heart Association. So your sleep, quality matters. If you have sleep apnea, you definitely need to be treated for it. It's not something to be ignored. And if you have the risk factors for sleep apnea, for example, obesity, if you snore at night, you wake up, catching breath, most of the times your partner will notice that more than you will, then you do need to get yourself checked for sleep apnea and get treated.
And what would be some of the warning signs, Dr. Farah, about sleep apnea? Maybe, I guess, gasping during the middle of the night. You may not, if you're not sleeping with somebody, you may not even know that, but if you wake up maybe with a dry mouth or a headache, is that an overall sign of sleep apnea?
Yes, all of those are signs. The most common sign is fatigue. People who have sleep apnea, they just get really tired throughout the day. They have a hard time carrying on with their duties. High blood pressure is another thing. People who have, they notice that they have a headache in the morning, and their blood pressure generally runs a little bit higher in the morning when they wake up. Those are all pretty common signs of sleep apnea. And I will tell you one other thing. There have been some associations with getting treated for sleep apnea and weight loss. So those who actually are compliant with their sleep apnea, getting adequate treatment for sleep apnea, they usually have a little bit easier time with weight loss.
So there's going to be a double benefit there, in other words. So is also one of the side effects, I mean, just being downright cranky. I mean, just irritable as all get out. Is that a major factor for sleep apnea, just being plain cranky or irritable?
I believe it could easily be, because people who have sleep apnea, they're not getting quality sleep. And
right.
So they're not well rested, they're tired. And so, yes, I could see how their mood can be affected as a result of that. And I will add, sleep apnea is something that can cause major issues in your heart. For example, rhythm problems like atrial fibrillation. It is something that sleep apnea is a risk factor for that. Additionally, there's something called right-sided heart failure, where, sleep apnea, it affects your lungs because you're not breathing well, and your pressure inside the lung goes up when you have chronic sleep apnea that goes untreated for a very long time. And that, in turn, increases the pressure inside your right side of the heart, and it can lead to a particular type of heart failure that's not good.
Well, drivers, and again, those listening out there, this is all the more reason for you to get your tail in and get examined by a doctor, because you see all the combinations of one thing leading to another. That could certainly lead to another. Dr. Fahmi Farah is on, and one of the best in North America. She is the CEO of what is called Bentley Hearts, and that is in the Dallas-Fort Worth area. We're going to talk more about that, and you probably have seen or heard Dr. Farah on other media. If you travel through some cities, she's been on television before, and like I mentioned, one of the most recognizable names when it comes to heart health and wellness. Doctor, hold on. We got a break for a few minutes, and Dr. Fahmi Farah is on the line with us. What questions do you have, ladies and gentlemen? If it's involving your heart, that thing right in the middle of your chest that keeps pumping, that thing that's keeping you alive each and every day, that's probably that is the most important organ of your body. If that thing ain't working, then, man, you ain't either. So let's get your thoughts on that. Restless nights, restless legs. We're going to get into all of that with some medical information. Stay tuned. I'll be back in a minute. SiriusXM 146. Drivers, hey, coast to coast and border to border. Dr. Fahmi Farah is on the line with us. And, Doctor, thank you as always. Very, very nice to have you on board. Let's get your websites out where folks can find you and reach out. Where can I go?
You can find me at www.drfahmifarah.com, also at Fahmi J. Farah on X and Instagram.
Okay, very good. Thanks very much for doing this for us, for the audience across North America. Now, let me ask you this. Many are saying, okay, doctor, I've got sleep apnea. Not breathing well, waking up in the middle of the night, et cetera, et cetera. The question would come up, what do you do to get a good night's sleep? What can you share? What do you do?
For me, it's very important to start with your sleep hygiene, making sure that you're minimizing your screen time, that you're not taking that phone to bed with you, that you're eating your dinner on time, a little bit earlier, not like right before going to bed. I typically take a warm shower and just make sure that my bedding area is clean and, that I'm decluttered so that all the stressful things of my life are turned off, so to speak, for at least 1 hour before bedtime so that I can get a good, restful night of sleep.
Okay, very good. And some folks have said, well, they like to work out before they go to bed, but I'm thinking, well, if you're working out, that heart's going. Probably 90 to nothing. So should you skip the nighttime exercising? What would you say?
I would say, yes. I would say try to exercise at least a few hours before your bedtime, because you're absolutely correct. When we're exercising, we're getting our blood going, right? Our blood pressure goes up, heart rate goes up. We are more alert, and that's the opposite effect we want to have right before going to bed. So, yes, absolutely encourage you to keep working out, not just do it a few hours before bedtime.
Okay, absolutely. And, we've all seen these in television shows and movies. Just have a warm glass of milk before you go to bed. And, man, that's been in the movies for I don't know how many years. Any truth in that? If you have maybe a warm glass of milk, which sounds terrible, but would that help you sleep?
Well, I'm not sure if there's any scientific data to prove that, but personally speaking, I do drink a glass of warm milk every night, and yes,
Okay.
I do feel that it helps me, so I'm going to promote that.
That's awesome. I did not know that. Well, and again, maybe Grandma was right. That warm glass of milk at the end of the day might help you unwind. And this goes without saying, right? I mean, if you've got, say, like the sleep apnea thing going on, like we mentioned, and you touched on this with a pre-existing condition like, say, diabetes, man, it just makes it a whole bunch worse, right?
Diabetes certainly makes everything worse, and it has a huge impact on your cardiovascular system. Those who have diabetes, the whole process of plaque buildup and all sorts of heart disease is actually accelerated by at least 3 or 4 times in comparison to the general public. So yes, those who have diabetes, it certainly makes things worse and faster.
All right, I just got a Facebook message in from Michelle. And, Michelle, thank you for writing this. And let me read this to you verbatim, that she has got restless legs, that her legs, and I'm just guessing that her legs are just kind of moving or motioning during the middle of the night. And she finds it very hard to get to sleep. Doctor, any recommendation as to what to do to calm restless legs? Is that heart connected, Dr. Farah?
It could be, yes. So whenever we have restless leg syndrome, it could be a number of different reasons why you have it. One of them is circulation issue, which is connected to your cardiovascular system, of course, but it could be also related to anemia. So it could be a multitude of things that can lead to restless leg syndrome that should not be ignored. I definitely recommend you to talk to your physician and get some lab work done to make sure you're not anemic, and also perhaps get your heart checked.
Okay, absolutely. Now, what about as far as children go? Dr. Farah, are you seeing more younger cases of cardiac issues involving, say, younger people, say, in their 20s or their teens? Is that becoming more commonplace from your vantage point?
We definitely have, and it's such an interesting topic you brought up. Since the pandemic, we've had a study that came out that basically told us that the age group of 25 to 41-year age group that we typically used to ignore when it came to heart disease, their risk of heart attack has gone up by between 35 to 41%.
Oh, wow.
That's a huge jump, and we're seeing this post-pandemic, so, possibly the virus has something to do with it. We don't know yet.
Wow.
There's something that's been associated with higher rate of heart failure, a particular type of heart failure that's called diastolic dysfunction. It's associated with vaping and the e-cigarettes that there's not very much regulation on. Our teenagers are one of the primary users of those, and yes, I worry about their future because we don't know what their heart will look like in the coming years because there's been a very strong association with that type of heart failure and e-cigarette smoking and vaping.
My goodness, speaking of smoking, a good friend of mine is in the hospital in Dallas area. Had a stent put in maybe about 10 years or so ago, and was a chronic smoker. Did it for years. Stopped about 20 years ago, though, and really never picked it back up. But now having some major heart issues going on, and his doctor told him that it is a result of smoking maybe 20 years ago. So if you smoke and you stop for, say, 10 or 20 years, could you still run into heart issues due to that, to the smoking? Could that linger, in other words, and show years later?
It could. That being said, I encourage everybody to stop smoking. Whenever you decide to stop smoking, regardless of how many years of smoking history you have, it'll help no matter what for your cardiovascular health as well as your overall health, of course, lungs as well. But yes, there's some truth to that. Like any history of smoking at all will have some lingering effects for your cardiovascular system. That is true for your heart as well.
Yeah, it's interesting, Doctor. I went to the grocery store the other day here in our area, Dallas-Fort Worth, and some of the cigarettes just in the regular pack size, I don't even know how many are in there, but it's running about $15 a pack, which is like, wow, that's just really expensive. I mean, I would think the money alone that you're spending would be enough to maybe put a stop to that. All right, doctor, thank you very much for joining me on the program. Dr. Fahmi Farah on Bentley Heart, and great to have her on board across North America. Doctor, one more time before I let you go, where can folks find you?
You can find me at www.drfahmifarah.com, also at Fahmi J. Farah on X and Instagram.
Okay, doctor, safe travels. Thank you very much for joining me on the show.